Hi. If you suffer from seizures or you have a loved one who suffers from seizures and even headaches, you deserve to watch this video. My name is Dr. Lonnie Herman and I'm with a wonderful family. This is Mrs. Nicholas with her son. This is Elias, right?
Yes.
Can I get a high five, man? So Elias, his parents, brought him to my clinic for the seizures he was having. I'm going to let his mother speak about the history with this. Seizures he was, and I say was as a past tense, having, and the headaches he was having, where medicine just didn't work. Okay? Yeah. So, Mom, if I can call you Mom right now, how long did you notice that he had suffered from the seizures? One, and how long for the headaches? Now, this right now is October 9th of 2019. Your first visit with me was in July, the first week of July of 2019, so 3 months ago.
Yeah.
And so prior to July of 2019, how long ago or how long before July was he experiencing those seizures?
So we got, in 2016, we had a personal experience where we had a car accident. And after that, shortly after that, 6 weeks later, we noticed that he had his first seizure.
Yeah.
And of course we took him to the doctor, and ever since we've been struggling to figure out a treatment option for him to get him out of the seizures or also the headaches at that point.
Mm-hmm. So the seizures started, it was all seizure and headache started right after that car accident?
We noticed the seizures first. Of course, that was visual. Elias was at the age of 3.5 when that first occurred. So he was not really, as a child, complaining about headaches at that point. When he reached the age of 4.5, that's when he said, "Oh, my head is hurting, and complained more and more about headaches at that point.
And how often were the headaches?
Every day.
Every day. How long throughout the day were the headaches?
You would see him just play and do his things, but then within like a couple hours you would see that he is like very annoyed and just not comfortable. Mm-hmm. So we would ask him what is going on, and that it's like, I would say with like regular treatment, like I would say like a Tylenol or Motrin, we would have him good for like a couple hours, 2 or 3 hours, and then he would go back to having headaches. Mm-hmm. He would rub his eyes a lot and just be not himself.
It happened a lot.
A lot.
Mm-hmm.
Yeah.
Every day, right?
Yeah, every day.
Every day. And it hurt a lot for you?
Yeah.
Yeah. The seizures, how often were these seizures happening?
At some point we had to battle with the seizures that it was more than 10-15 times a day.
10 to 15 times a day?
Yeah.
And this was every day?
And that was pretty much every day. It gradually like increased itself, because before we had this accident, he was perfectly fine. He had never suffered from a seizure before. And then after that, when the first one occurred, it just gradually increased, and he had more and more seizures, and we went to the full-blown grandma seizures. He got first diagnosed with absence seizures, which whoever suffers from seizures as well knows that they're just literally stare-offs and short ones, like 30 to 35 seconds, more like a daydreaming type of seizure. But we developed multiple types throughout the years, and it got that bad that he wasn't even able to go to school when it was time for him to go to kindergarten. He missed a lot of school. He had a lot of headaches. Injuries occurred with that as well at that point.
Injuries?
Yes, he fell, he hit his head, he got a cut in his, right, remember that?
Yeah, I totally remember that.
Because the seizure, he fell and hit his
Yes,
head.
It was kindergarten.
Really?
It was kindergarten.
What was happening there?
I was like staring, and this weird thing happened.
A weird thing happened.
Yeah.
Yeah.
Yeah, so, and this was every day?
I
And
couldn't
it's-
remember what it was called, but it just happened.
It happened.
How many months was it going on for before you came to me? How many months did he deal with this again? Was there a couple of years at least?
Yeah, we had it partially under control, I would say, because we watched his sleeping schedule, we watched his diet a little bit, and then I would say in 2018, the late of 2018, we had a really like an increase in these seizures, and he started to struggle a little bit more with that. So we went to see the neurologist. We got certain medications.
Was that at a private practice or was that in a hospital, a university or something?
Well, we went to a couple of neurologists and a couple hospitals because we just weren't happy with the treatments what we got by the different types of neurologists.
And those treatments were meds?
And these treatments was meds. We started with Keppra. We went from Keppra to 5, 6, 7 other medications at that point, and that turned him pretty much into. He had he was not reacting good to it. He wasn't eating. He was very upset. It was not my child. As soon as I started giving him that medication, he was turning, his mood swings and everything was changing. And it was like a type of a honeymoon for him. He was good for like 2 to 3 weeks without seizures. But once these 3 weeks fell off, then he started having even more seizures and more defined and more scarier, because I remember clearly when he was even on Keppra that he had a seizure at night. He was foaming, he was having blue foam coming out of his mouth. We were unaware that this was even going on at nights that bad until that point when we had him sleep with us, because the seizures increased so much with the medication that it was out of control at that point. And then we decided to not treat him anymore with these medications.
Not anymore with the meds.
Yeah.
And what did the doctors tell you when you told them that he was having more seizures with the meds?
I mean, technically, they always tell me increase the dose. Increase the dose. The more you increase the dose, the more you make your child kind of numb to everything. Like a zombie, yeah. To that term. I guess that's a very common term in that field. And it's kind of, it has a lot of side effects with that. It's not just that the learning disabilities come out, and the whole behavior part is very, very concerning at that point for me. And they're just not, you don't have your child in front of you when you start these medications. And in the end of the day, I had even to battle more with these seizure attacks, and I feel like also that with these medications what I gave him, we went from absent seizures to tonic clonic seizures to myclonic. I'm not sure if I pronounced that right, but he has multiple types, or he's much better now, but he had multiple types of seizures to the point that he wasn't able to attend school.
And so now, for the past 3 months since you started the care with me, you stopped the medication.
Yeah.
Completely.
Yeah.
Right? I didn't tell you to stop the medication, but you decided because you saw how it was making him worse in multiple ways. More seizures and the zombie-like kind of appearance.
Yeah, because we had like once it turned to like really to the point where it was out of control, we took him to the hospital and we got a medication there, which we found that we had no other choice at that point anymore, because he was really bad with his seizures. And we did this medication for 6-7 weeks, I believe. And then Elias was again on this honeymoon. The same rotation happened again, which happened with any other type of seizure medication we tried before. And it turned into very intense, bad grandma seizures, which, I mean, he had 15 to 20 seizures before a day, but these was not the grandma seizures. It was these short fallouts, or like, it was not like in this intensity how it turned once he was over the honeymoon with that medication what we got from the hospital. And then
is that when you found me? Right at that point? That's when you started looking, saying something is wrong in medicine?
That's something where we're like, okay, we have no other choice. We got to find something else out. And then through recommendation, we found you. and we stopped giving him the medication, and he started the vials.
And now with these remedies, which I'll describe in another section of this video, but with these remedies, how quickly did you notice his headaches? And there was no other treatment, so how quickly did you notice his headaches disappear? Because the headaches are, first thing, the headaches are totally gone.
Headaches, how are your headaches now? Are they still there?
Mm-mm.
They're gone.
They're gone.
How long have they been gone for?
How long
long
have they been
time?
gone? What would you say?
I will say, I just don't remember.
You don't remember. That's a good thing.
That's a good thing.
Well, we started again 3 months ago, and I would say we saw a significant difference within like the first 5 days.
Mm-hmm.
Even that much that he had like a little rash coming from his skin and stuff like this, and you know, like we noticed changes in his whole
Appearance.
appearance.
Yeah.
And also from his smells and everything. So once we started these remedies, he started to improve very well and very quickly too. And we were pretty much seizure free within, I would say like the first 2 weeks of using
started
these
then.
remedies.
So right now he's been seizure free, just about, because sugar still set off a challenge. So
Correct.
which we're fixing in this round, which I'll describe in another section of this video about that. But without that, even with the sugar stimulant,
Yeah,
the seizure lasted how long?
maybe 20 seconds.
Maybe 20 seconds, and
if
it wasn't
even.
it wasn't a major grant.
No, it was more like a very short, like snap out, like for him.
And so with that, besides that one, which we're still going to fix that one now, but besides that one, it's been
It's been
1 or 2 like that in the
Yeah.
past 3 months.
yeah.
Yeah, so we
That's
have.
definitely.
Yeah, this is not the same cycle as it was before with the
No,
medication.
no, it's even to that point that he feels like we're not giving him as much as attention because we wouldn't call his name out as much anymore. Before we would call him to ensure that he is not having
He's
a
okay, yeah.
seizure or that he is okay, and now we're not calling him as much as anymore. So he has now
like,
he
no.
wants to have us pay
You need more
attention to
attention,
him
huh?
again.
Yeah.
So. But he's been feeling great. He's, truly, in the beginning of June, I wasn't sure if he'd be able to make it to school. Within mid-July, I was pretty of a good standing to say, okay, he is good to go, because I was still scared with this honeymoon repeatness there, what could happen with medications, and it
And
didn't
these are
happen
not
with the remedy.
Yeah.
It
The
didn't
remedies.
happen.
It didn't happen because
It
we're
didn't
fixing
hap-
because we're
Exact-
fixing what caused it.
Exactly.
Yeah,
So once school started, he was able to go, and he hasn't got sent home, not once. So he.
And the only reason why we sent him before, not because he's a bad kid, but because he wasn't able to perform
He
well. He had a
couldn't-
seizure in school.
School would call me every single day to pick him up. I would bring him, and within an hour and a half, I had to pick him up.
He couldn't concentrate. He could have a
couldn't.
seizure and the
He
headaches. Yeah.
had seizures all
Yeah,
the time.
so it was a bad thing. So now that challenge is not there anymore.
No,
That's
no.
gone.
He's
doing a
perfectly
lot better.
fine, like just like any other child.
Yeah, excellent. Any other child who's not having seizures and not
Exactly.
having headaches, and who can
Exactly.
concentrate and focus and enjoy his
Yeah.
day. Yeah. So we're pretty happy right now with where we are.
Yes.
You're pretty happy with it?
Yeah.
Yeah, man. All right, good. It's almost your birthday, so I'm glad that we can do that for you by your birthday. Is there anything that you want to tell the parent who's watching this, who has kids or one or more of their children are having seizures like this, or they're taking the medications and they have these headaches and they're just not really getting the relief that they want to get with the medications or other practices that they tried? Is there anything that you can share with them about this work with me?
What I just can put on any mother's side, when we facing these challenges, most of the time we believe just what a doctor tells us to do, but at the same time we got to watch what it does to our children. And the moment we started these regular medications, or even these seizure medications, which has not even been clinically proven to improve seizures, it's a tryout. Everything what they're doing, it's a tryout. It is not healing the cause of the seizures. It's just putting a lid on it, and once that gets to a point that it's too much tension in their brain, it's causing even more problems than what you ever had faced before. Withdrawal symptoms, and even just the withdrawing from seizure medication is very, very crucial to these children, and I would highly recommend before any treatment that everybody acknowledge and educate themselves first before starting anything. What you put in your children is very, very powerful, and a drop of water can change a child's
Well,
life.
they don't know about this yet, what this is yet, so we're not telling them what that is, which I'll tell them, but it changed everything.
It's just, it changed everything,
Changed everything,
and
right.
I would really encourage people to look into these treatments, what we're doing with Elias right now, and I mean, how are you feeling?
Good.
You're
Yeah.
feeling good, and that's been a very long time for us to have him say that he feels 100% good, and yeah, I'm just very happy
Yes,
with that.
excellent.
Yeah.
So thank you for that. Yeah, so we can find why these neurological disorders occur. Until you can find why, you don't know what you're treating. It's not about treating the symptom, it's about being able to find the weak tissue in the brain and finding why that tissue in the brain is so weak that causes the malfunction, that causes the neurological malfunction to take place, the seizure to take place. Right now here is another case here of proof of this working. When I'm providing this young man and his family is relief of the condition, of being able to get back to life and not worrying about the child having a seizure every day, every night, multiple times a day. When we can pinpoint and safely remove the different infections from brain tissues that we can discover with how I practice, with this unique method I practice, and be able to strengthen brain tissue and be able to relax the arteries that bring the blood flow with the oxygen into specific parts of the brain, so those parts of the brain can relax and the seizures can stop and have sustainable relief. Sustainable relief. Your improvement, his improvement is all that matters. It's about getting the great results and allowing you to get back to life and enjoying life and not live in fear every day of these seizures and being trapped in the condition. So I really appreciate you coming on and sharing this with everyone. And get ready for another video that I'll be connecting right now, and you can hear all about his treatment, okay? Thank you.
Bye.